going to try and live long with this Omicron variant because we've got breaking news because this variant is now here in the U.S. and detected in San Francisco.
The individual was a traveler who returned from South Africa on November the 22nd and tested positive on November the 29th. The individual is self-quarantining, and all close contacts have been contacted, and all close contacts thus far have tested negative. The individual was fully vaccinated and experienced mild symptoms, which are improving at this point. So this is the first confirmed case of COVID-19 caused by the Omicron variant detected in the United States.
All right, so it's here. Dr. Anthony Fauci confirming health experts and scientists will monitor the fast-spreading variant, which has been detected in 24 countries so far, including, once again, here. Meanwhile, the CDC is cracking down on rules for travelers from overseas, requiring testing within a day of boarding a flight back to the U.S. But they have not shut down travel from other countries except Africa. Dr. Frita Fisher, founder and president of Midtown Atlanta Nephrology, is here to help us understand how we can best stay protected from this new variant. Welcome back, and thanks for starting your day with us. We always appreciate talking to you. Wish we was talking about other things besides COVID-19 right now. But since we still don't know a lot about this variant, we still hear a lot of people saying, we don't know, we're still testing it. What concerns you the most?
Good morning, Mike. It's good to be back. I'll tell you what concerns me the most. I'm concerned that people still will not take mitigation factors seriously. We have seen variants before. Of course, we have the Delta variant, which accounts for over 99% of the cases in the United States right now. We have the original wild type variant. We have the vaccines out that we know are safe and effective. Yet we still have so many people who are still refusing to wear masks. Some are burning masks. People who don't want to socially distance. People who spread untruths about the vaccines. So what worries me the most is that even though we have similar things happening over and over again, and that is variants, I'm worried that people still won't take it seriously enough.
Yeah, it was crazy. As people are still dying at a very high rate, it just appears that a lot of people in this country have been desensitized by it and trying to live with it, ironically, while still dying with it. But now that officials have a sample of the variant here in the United States, what do you think the next steps are? What will they do with that?
Well, the next steps are some that are already being taken. One, we're trying to get people to do what we already know works. Get vaccinated. And if you're eligible for a booster, meaning you had one of the messenger RNAs, Moderna or Pfizer, more than 6 months ago, you completed your series, get boosted, because we know that high levels of antibodies give you a greater chance of protection, even against the variant. You remember when we made the vaccines, they weren't against the Delta variant. They were against the wild type, the original. They were against the Alpha variant. Yet we know that when you have high antibodies, it still gives some protection, which is why the vaccines do so well with Delta. So after that, we're going to find out if our current vaccines work against Omicron. We'll take the spike proteins, we'll take the sample of the Omicron, and we'll mix it with the serum of people who have been vaccinated, and we'll see if the antibodies actually work against the Omicron. Now, that's going to take time, at least a couple of weeks. So in the meantime, we'll do what we can do and still try to protect ourselves.
So when it comes to Omicron and Delta, some scientists are saying Omicron has milder symptoms, but it spreads more quickly than the Delta. And I'm hearing that might be good news. Explain.
It's possible. And, you know, again, it's so tricky because we keep saying it's too early, we don't know yet. And that's because it's too early, we don't know yet. But yes, from what we have seen, based on the over 30 mutations in the spike protein of the Omicron variant, it does appear to be more transmissible, more contagious. Plus, we know that in South Africa, the Omicron variant is already the dominant variant already. And so it looks like it spreads more easily. But in the cases we've seen, the symptoms have been pretty mild. Granted, we've seen most of the cases in relatively young people. And so it's not like we have a huge population size. The only way that that could be a good thing is if you have people who are testing positive for Omicron and having just enough immune reaction to have some type of immunity and protection without actually getting sick and dying. That could be a good scenario. But an even better scenario is for people to be vaccinated and try to prevent infection altogether so that Omicron does not become the next variant and the next variant, which may not be so mild.
Yeah, and the more people that get vaccinated, then these variants won't continue to spread as rapidly, so we won't be going to Omicron, and then we'll be Zeta and all the other different letters of the Greek alphabet that's out there as well. I don't even know. But, you know, like, so are the mildest symptoms being found in patients who have been vaccinated or unvaccinated? Do we know that?
Well, it still looks like most of the people who are sick are people who have not had boosters and people who have not been vaccinated. For sure, we have cases of people who have been fully vaccinated. In fact, the first confirmed case here in the United States, that patient was fully vaccinated with Moderna. But reportedly, the symptoms are mild. But as far as most people thus far, it still looks like they're the people who are not fully vaccinated. And in South Africa, unfortunately, right now, they do not have the best vaccination rate. Something like 25% of people in South Africa are vaccinated. But yes, it looks like the vaccine still potentially can give us some protection. So right now, that's our best case scenario.
I'm getting a wrap. I got to go in 30 seconds. Are states doing enough, though, Dr. Frita, or has this thing just become so political that even politicians are afraid to shut things down, make people wear masks again? And we're being told we need to wear masks a little bit more here in LA, which we have been doing. But should they be doing that in more states, or has this become so political that politicians are afraid to shut things down because they're afraid of the reactions by their constituents?
Mike, everything has become political. But what we need to do is follow science. Already the CDC is requiring testing within 1 day of returning to the United States if you travel internationally. Already they're lengthening the mask requirements on trains, on planes, on buses. And so they need to do more. And at least the administration is doing more. And we have to not so much worry about politics, but worry about public safety.
Yes, and we need to listen to you, and we need to have you back on the show more often. Dr. Frita Fisher, we always appreciate you and your knowledge and your dance moves and following you on Instagram and seeing you do your thing, because we love that. You're entertaining and you're knowledgeable. Thank you for starting your day with us. We appreciate you.